Welcome back. Now, it's the new year. Of course, we've all been talking about it for the last 3 days, which means a lot of people come up with new goals, new resolutions, new things to change yourself. And while things like working out, eating better are important, mental health should also be something that you prioritize. This afternoon, I have Dr. Parinja with me talking more about a topic many folks don't talk about. Doc, thank you so much for joining us.
You're welcome.
Now, tell me a little bit when it comes to mental health, kind of what exactly should folks be focusing on? I know we said depression.
Right. So depression is probably the commonest mental illness that gets people looking for treatment. Anxiety is another one. But depression kind of comes out on top in terms of disability. It's the leading cause of disability worldwide, more than any other illness that there is. And depression can be, it tends to be more common at this time of the year for a number of reasons. The weather doesn't help. The seasonal affective disorder is a specific kind of depression that tends to happen in winter. This is the time of the year when the parties and the celebrations are behind us, and sometimes some of those celebrations have not gone well. So people are stressed from all the negative interactions that they might have had with certain family members, all the money that they have spent. They may not have something very immediate to look forward to like they had in December. So all of those things can feed into people getting more depressed.
Never thought about it like that. That's true. So then what are ways, in a sense, how should we cope? Are there smart mechanisms? Should I go immediately into medication? Like, how do I deal with the fact that, okay, now I'm sad and I honestly don't know what to do?
Well, feeling sad at this time of the year is common. Not everybody who feels sad has depression. If you are feeling sad a lot of the time, most of the time, most days, then you probably do have depression. And I think the first thing to do is to see somebody and get a diagnosis, get it clarified. And then if you have a moderate or severe depression, then you should definitely get treatment, because that tends to persist, it tends to affect the quality of your life, and it can get worse over time. So milder forms of depression sometimes go away on their own. As the weather gets better, as things get better, But I think if you're concerned, you should definitely see a professional.
Now, when you say concern, my thought is always, you need to shake it off, right? We just pretend as though we're good. Or maybe I can medicate, maybe a little bit of wine. Wine makes me happy, doctor. What about that? Or, now that Ohio has legalized marijuana, marijuana makes me happy. Is that a good alternative?
It isn't, and there's a number of reasons for that. So you're right, when you drink, at the time that you're intoxicated, you might feel a little better. And that's because alcohol will release certain neurotransmitters. It will stimulate certain systems in the brain, which make you feel a little calmer, a little better. But it's like, if I'm poor, I'm not going to benefit from borrowing money from the bank. It's like you're using up those neurotransmitters, you're not really replacing them, and your deficit tends to build up. And very often when people are coming off from a binge of alcohol, they will be feeling more depressed and more anxious as well. The same roughly applies for marijuana. Marijuana helps people feel less anxious, less depressed. It mellows them, and that's what people often tell me. But again, that's a temporary thing. And if you keep doing it, your brain actually adapts to that, and your baseline can become a little more depressed and a little more anxious. So I don't think that those are, you should self-medicate with those things, because it can worsen the problem.
So then, well, fine then. I won't do drugs and alcohol. So then what else can I do, honestly? What are some things? Because I did, suggest, slightly jokingly, but of just ignoring it. But obviously, what are maybe healthier ways, apart from medication, that you would suggest I try?
So if you have a diagnosable depression, then you should be in therapy or be on medication, or a combination of those two. But if you're just feeling sad, a little lonely, isolated, then a lot of things that work for your physical health also work for your mental health. So physical activity helps. Watching your sleep helps. Go to bed on time, wake up on time. Connecting with people, people with whom you have a good relationship, who are supportive of you, not somebody who brings you down. So family members, friends, reach out to them, meet up with them, connect with them, go out, go for a run if you are fit enough to do that. All of those things help. I mean, there are now studies which show that structured physical activity can be almost as effective as medication for the treatment of depression and anxiety. And those are easy to access, relatively side effect free. So why not go for those to begin with?
Dr. Parinja, thank you so much. Very valid things. So again, if you're going to self-medicate, make it healthy, make a choice, and of course, definitely seek professional help if you need it. But for now, we will be right back.